Hi, and welcome to our presentation on Zika virus and climate change. I'm Zoe.
I'm Tabitha.
I'm Carrie.
I'm Melissa.
And I'm Michelle.
The El Nino weather event of 2015 and 16 increased ocean and ground surface temperatures in South America, and as a result, a conducive environment for the 80 species of mosquito to thrive was born. Higher average temperatures and increased rainfall in the region lead to a longer mosquito season and higher mosquito density. Climate models suggest that the Aedes mosquito has the potential to widen its territory and move more inland and away from tropical zones. The impact of the conducive weather conditions has been an increase in prevalence of the Zika virus. While the virus can be asymptomatic in the majority of people, some common symptoms are rash, fever, headache, muscle pain, etc. However, Zika can cause serious birth defects and can be transmitted sexually. There is ongoing research and development to better understand the virus's pathogenesis, be able to differentiate it in lab tests from viruses carried by the same species of mosquito, and to create a vaccine and treatment for those who have already been infected by the Zika virus. Unfortunately, these could both take several years to be made public. There are several methods of exposure that lead to Zika infection. Mosquito bites are the most common transmission method, and this is a standard method of infection that's seen in other mosquito-transmitted infections, like dengue. Mosquitoes lay eggs near water, which is why high temperature and increased rainfall due to climate change is problematic. Another method of exposure is vertical transmission, which is where a mother passes the infection to her fetus in utero. This can have adverse health effects once the baby is born, which we'll cover in coming slides. Zika virus is also found in breast milk and can be passed to babies that way. A third method of transmission is through sexual contact. The virus can be spread through bodily fluids, even if the infected person is asymptomatic. Current research is focused on how long Zika stays in bodily fluids, but it is known that it lasts longer in semen, even longer than in blood, which is another method of transmission. During the outbreak in Brazil, there were reports of cases that were transmitted through blood transfusions. The climate change-related hazards that impact exposure to Zika are mostly related to mosquito transmission. Mosquitoes are sensitive to temperature change, so they're a major vector of concern. With warmer environments and increased rainfall, mosquitoes have higher reproduction rates and increased feeding, all leading to higher exposure.
Next, as exposure to mosquito carrying Zika virus is increased due to climate change, the transmission rate of the virus is also increased, thereby increasing overall risk. This is important from a public health perspective because human infection with Zika virus can produce an array of health effects. It is important to note, however, that roughly 75 to 80% of people are in fact asymptomatic. Because these individuals are not experiencing symptoms, they may neglect seeking out medical care. This makes it difficult to diagnose and extremely difficult to track incidence and prevalence rates from an epidemiological perspective. Those that do experience symptoms tend to have them from a few days to a week, and they may include fever, rash, headache, joint pain, red eyes, and muscle pain as mentioned before. More severe infections may result in neurological disorders like Guillain-Barré syndrome. While this is rare with 1 in 100,000 people affected, it still has significant impacts to health as it is an autoimmune disorder where the immune system essentially attacks the nervous system. Luckily, infection with the virus is rarely fatal. Zika virus infection during pregnancy is a hot topic worldwide, and I will explain why. Zika virus infection during pregnancy has been linked to various birth defects. Microcephaly is an example of a birth defect that results in a baby's head being smaller than normal due to improper development. As you can see from the picture on the right, there are also levels of severity for microcephaly. Another birth defect linked to infection is congenital Zika syndrome. This results in severe microcephaly, decreased brain tissue coupled with brain damage, eye damage and hearing impairment, joint issues like clubfoot, and seizures and muscle tone that impair mobility. Miscarriages and stillbirths may result from infection with Zika virus. However, not all women who are infected will have a baby with a birth defect. So what can be done for someone that has Zika virus infection? Currently, there are no vaccines available to prevent an infection, and treatment is often accomplished through supportive care. This includes plenty of rest, fluids, pain relievers, and most importantly, communication with a physician who is overseeing care. Prevention is key, and awareness of the risks associated with Zika virus exposure and transmission is crucial, especially if an individual is going to be visiting an area with increased mosquito populations due to climate change.
Challenges to combating Zika virus are both environmental and socioeconomic. Many times in areas that are infected by Zika virus, the healthcare is not going to be what it is in the Western world. And because of this, it can be difficult for people to seek treatment if they have been infected, and it can prolong the transmission. Also, because these areas don't have usually a very good healthcare system, public health and government agencies usually need to get involved, and that can take time. Because Zika virus is so dependent on climate change and the activity of the mosquitoes, this also means that we are uncertain of where Zika will have an outbreak next. And often, as we heard before, Zika virus is likely to be asymptomatic. And because of that, it can be really difficult for us to get a true estimation of prevalence and incident cases of Zika virus. The further challenges include the fact that it's a really complex interaction with the environment. Interactions with the abiotic environment include climate, water, and urbanization of land use. And also interactions with the biotic environment include the activity of the mosquitoes during a particular season, and also the geographic variation in transmission potential. So that would be people traveling to areas that have Zika, leaving and not knowing that they're infected, or being asymptomatic for quite some time. And lastly, solutions to combating Zika virus. We can obviously continue to increase education efforts in areas that are likely to be infected with Zika virus, ways to stop transmission, what to do if you get infected, and where to seek treatment. There's also a neat study that I found where they engineered Aedes aegypti mosquitoes with a bacteria that rendered the male mosquitoes sterile, and then they released them into the environment, so that would decrease the amount of mosquitoes available to infect people.
So now that we've talked about some of the challenges and possible solutions to the Zika virus spread, some of the scientific limitations include that the impact of climate change on the spread of Zika virus can be exacerbated by extraneous factors. So for example, El Nino weather patterns tend to cause more rainfall, which increases the habitat range for a mosquito vector. But this does not necessarily mean that this will be the case every year, so that geographical range can change. In addition, the spread of Zika virus is modeled to be very similar to that of other viruses such as dengue, and this is all really speculative modeling for Zika virus because the outbreak in 2015-16 is the first large-scale outbreak that we've seen in many years. Another important aspect to consider is the lack of proper diagnostic tools for Zika virus. Because the majority of the time PCR testing is used, and this causes a high false negative read. So accurate testing is very expensive and difficult to use in resource poor settings. And so when you put everything together, it's just really difficult to determine the actual impact of climate change on increasing Zika virulence.
So the policy implications for Zika virus. So there are numerous ongoing research and development efforts to try and understand the health effects of the Zika virus on various populations, as well as on the overall environmental impact. By working towards developing a safe and effective vaccine, refining lab results to differentiate the Zika virus from similar viruses, educating the public on the risks of the virus, defining the period of transmissibility via non-vector transmission, establishing the linkage between Zika and harmful birth defects, and establishing what the safe period is for women who want to become pregnant after being in a region where Zika virus has been prevalent. These are ways we're taking steps to further understand the virus and to establish potential policies. And then there are several already federally funded efforts which are underway to try to further our understanding of Zika virus. So the policy potentials are that there's great potential to try and control the negative impacts of the Zika virus and overall climate change. And one of the ways is to increase physician participation in climate change policy. Since physicians experience firsthand the adverse health effects of global warming, be it via increased incidence of respiratory problems due to poor air quality, smoke from wildfires, or longer pollen seasons, or from an increase in cases of mosquito-borne illnesses such as the Zika virus. Policymakers might be more willing to listen when climate change is framed in terms of health issues that physicians encounter on a daily basis. There's also great potential in terms of developing a safe and effective vaccine. Through trial and error, researchers are working on developing a vaccine, but a vaccine for the Zika virus could still be several years out. There's also early research being conducted on a potential treatment for the Zika virus using different screening programs to test existing drugs for their activity against Zika. So in conclusion, resources are needed to continue researching and tracking climate change patterns and how that impacts the reach and global burden of the Zika virus. Ongoing research and development efforts are needed to try and find a safe and effective vaccine as soon as possible. That could still take several years. So in the meantime, focusing on climate change policy could be beneficial, especially using physicians to help influence climate change policy by highlighting the health implications that global warming is having on the population, be it respiratory issues or mosquito-borne illnesses like Zika virus.